Hi, Mrs. Shen
Hello.
and Frida. My name is Dr. Johns. Welcome. I see you're new patients to our clinic. This is my attending nurse, Abigail. She'll be here during the exam today. Sorry about the small room, though, but I hope you'll be comfortable. It is a standard procedure.
Yeah, no worries. Thank you for seeing us today.
Okay. Well, first off, how old are you, Frida?
13.
So our clinic policy is that all patients 13 and over can be examined and treated without adult supervision.
Frida's shy, really shy, and she tends to have difficulties at her exams. And so we did talk about this, and we did agree that it would be okay for me to be in the room to make sure she gets the support that she needs.
Is that your intent to stay in the room, Mrs. Shen, during the exam?
Yes.
Okay. Is that okay with you, Frida?
Yeah, she can stay.
Okay. Well, Mom, if you'll stand to one side, then Frida can have a little bit more privacy.
Sure, whatever you need.
Okay. So, Frida, what brings you in today?
Frida's been sleeping around with boys, and
It hurts when I pee.
because she's been sleeping around with boys. So this is why we're here, so that we can address this. This is not the first time that she's got the clap, and it's the situation is what it is.
So, you think it's gonorrhea? You've had gonorrhea before?
Yes. This would be she had it 3 times before. So I know there's a concern because we're concerned, and we're definitely trying to address what's going on. I don't know what to say. It is heartbreaking, but I think she has a problem. She's seeing a therapist because we're trying to really figure out why at this age is this happening.
She's seeing a therapist?
She has seen a therapist. She started seeing a therapist a month ago. And so that relationship is new, but she is seeing a therapist. Truthfully, I think she's bipolar.
Well, let's be careful with assigning labels, but is Frida seeing a psychiatrist? Is she on any kind of medication?
No, not yet. Do you recommend any medication?
Well, it might be helpful for me to talk to her alone.
Yeah. And, even she has difficulties with her own therapist. It's a struggle to get her to the appointment, and then, she doesn't really talk much. She is very open with me and her dad about things, but this is more so why I'm in the room to really help her say what needs to be said.
Well, it might be helpful for me to talk to her therapist.
Definitely. I can definitely sign a release for that.
Well, Abigail, if you can prepare a release of information form for you to sign on the way out.
For sure.
Yeah, I'll get the front nurse to prepare that and just stop at the office on the way out.
Okay. Thank you.
Okay, well, let's get started. Frida, I'll have you lie down and have your legs up on the stirrups.
That's okay. I'm here.
Well, Frida, it definitely is chlamydia. I'm going to prescribe you some antibiotics. I want you to follow the directions precisely, though.
And I will make sure she follows them.
Well, so with chlamydia and other sexually transmitted infections, it can eventually affect your reproductive system. So it's always better to practice safe sex. Do you know how to use a condom?
Oh, yes. We've gone over it many times. So she knows. Unfortunately, she does.
What about some birth control?
Oh, I don't think that's going to work because she's not going to keep up with it, and I don't know how I can help her to keep up with it. I'm not too sure about the birth control pills, but I feel like, with her having a therapist, we can really work on her sleeping around.
Well, I hope so. I have to admit it is troubling that she's had chlamydia now 4 times and maybe even gonorrhea in the past. And she's only 13.
Yeah, I know. This is very troubling for us as well. And we're going to make sure we solve what we have to solve right now with her help. And I can only hope that therapy helps.
Okay, well, Frida, you know where to find me if you need me.
I'm sorry. We have another appointment. So I'm just wondering what is the next steps.
Well, I think you're good to go.
Okay.
Just remember to stop and sign the release, and good luck, honey.
Okay. Tell me if the infection doesn't clear.
Do we have to come back again to do any type of follow-up or anything?
No.
No.
But, you can get back to us if the infection doesn't clear.
Okay. Definitely.
Thank you, doctor. Thank you, nurse.
You're welcome.